Yeah. So you've read my work and I've read yours. So we have some familiarity with each other's work and also who we are as people, because you've shared personal things in your book as I've shared in mine. So we have a beginning inkling of who we are as people.
Yes,
So I'm just I'm just thinking of this of us having a conversation and just let the conversation go where it goes.
absolutely. Same here. I haven't prepared anything to care advice with that. Um, and I guess I wanted to start with I find it so fascinating that two people of two generations from completely different sides of the world, having been primarily in clinical as opposed to academic practice, right, sort of arrive at the same conclusion around what is most helpful to our clients, which goes a little bit contrary to the traditional trends of teaching, or I could even say um, current psychotherapist training. And that includes, counselor, psych, the whole.
All the different realms of various kinds of people offering this kind of help. It goes against the traditional pathways. Yes, for sure.
We recently moved from Michigan to Ohio, and for some reason, my license didn't transfer initially. So they told me I had to take the counseling exam again, which I had taken, 20 years prior.
Oh,
So I order all the learning material and I start studying. And a month into it, for the first time in my life, I thought, I don't think I'm going to be able to do this. And I've in the past always been, I've done well at school. And the reason was it was so much more material to learn about theories and techniques and theoreticians, and with such tremendous minute detail. So basically, you have to memorize, which our capacity for that decreases with years. Plus, I found that my motivation to learn things that I knew I would forget the next day and were so used to me in my practice, I have no more motivation to it. And when you have no motivation, you can't keep it in your mind. So one of the things that was striking in this, mountain of knowledge that they want us to learn, and I want to always be clear that I'm never against learning or knowledge. I'm very fond of all the theories and techniques. I've been highly trained, and also where I'm coming from and the discussion I'd love to have with you is around what is missing and what is off balance. And I find that we've done really well addressing the needs of the mind and filling it with all the knowledge that's out there. And we there's no mention anymore of anything that has to do with our heart space and the other mechanisms that are involved there. So I've talked a bit to make it a conversation and just see what resonates of what I've said. And
well, I was in a similar position because I used to live in New York. My wife and I, Gina, I used to live in New York, and so we had to come to Massachusetts. I was dreading that I would have to do all of that because this was 25 years ago, and I'm 80 now, 82 actually. Um, and but they accepted my application, and they said instead we're going to have you just come for an interview. So I didn't have to go through all of that, and that would be a nightmare. It would be a nightmare to have to do that. Yes,
absolutely.
yeah, and it's eminently clear that even in the professional readings I do now, because I mean, the state requires that I get a couple of 20 credits in continuing ed every 2 years. Otherwise, I lose my license. So I keep up with things and I read things that other professionals recommend to me. And the infrequency of any kind of involvement of bringing in the energy of the heart is really astounding to me. Yes. And yeah,
I've read in your book, but for those of us that might be watching us, would you clarify what it means? What is involved with the heart?
well, it just happened just at this moment, right? When you said that you touched this part of your body. And I watch with that when I'm talking with patients, particularly male patients who are not comfortable in the realm of talking about their emotions, that whenever they touch this area, I ask them, so what's happening in your heart? Yeah.
Yeah.
Yeah. So that I feel that what we need in this kind of work is a synthesis. So all the theories and techniques and strategies are important. And on the other side is the realm of the heart of having our patients. I use the word patients, not clients. That they be in the energy field of a compassionate presence, so that I'm offering any kind of counselor, therapist, pastoral counselor, coach, psychotherapist, anybody who does that work, that to also bring in your compassionate presence, because it's the compassionate presence that offers whoever we're talking with a sense that of safety, that this is a person whom I can talk to who's going to respond not simply from here. They're going to respond from their hearts. And to feel that from us and to be able to express that and sometimes to act on it through some aspects of personal human touch, because sometimes what the person needs most from us after they've been weeping in sadness is a hug. If there is, and I usually what I say is, would it be okay with you if I gave you a hug? So I'm getting a sense of the person if they can be receptive to that.
Yeah.
And if not, then think about we'll just a touch of hands, any kind of human contact, which would be an ordinary human thing to do with somebody that we care about if they're weeping.
Yeah.
Or they're expressing a tremendous amount of anxiety, or they're going through a big sadness, or a sense of hopelessness. If it was a family member or friend,
What we're talking about is bringing back our humanity into the therapeutic relationship without worrying about being unprofessional or inappropriate or unboundary.
yeah, to really be an authentic human being and a trained professional. So the synthesis of those two things
Yes.
is profoundly more healing than just implying certain kind of techniques.
Absolutely. And if I were to ask why, we would start talking about this concept of the therapeutic relationship, right? How that actually is one of the most profound things we get to offer another person. And that is it, right? It involves two people. It's an interpersonal something. And it's sometimes hard to fully define what makes it up. But the presence of the psychotherapist is a big part of it, isn't it?
Yeah, well, the way I think about it, so you and I, so this is where you are sitting would be where a patient would be sitting. So now we're in this physical proximity, and we're sharing this interpersonal space. So our consciousnesses are intermingling, right? And so that then the person being in my energy field, experiencing my consciousness and my heartfelt empathy and compassion for them, they experience that at many realms of consciousness, even if they're not rationally aware of it or thinking about it, they're experiencing it because we're in this energetic field with each other.
Yeah, and people pick up everything, don't they? Some of it unconsciously. There's that concept in Gestalt psychology that we can only take our patients as far as we've traveled.
Mm-hmm.
And I find that to be true. I find more often than not, some topics that I'm not particularly comfortable with, my patients are not bringing them up with me, and vice versa.
Yes.
And
And the other aspect of it is that we're human beings, we're having our life experiences. And so one of the things that I experienced a lot in doing this work, and I've been in this role this for 50 years at this point. And so in that time I've experienced a lot. And each thing I experience in my life expands my heart. It widens it and deepens it. So then my capacity for being empathic and compassionate increases.
absolutely, absolutely. I remember when I first started, in my 20s, and I was taking supervision at the time. I was not yet a mom and happened to be seeing children. And inadvertently, every single client's parents' first question would be, are you a mom yourself? And I remember being mad about it, going to supervision sort of defensively and saying, I don't have to be a mom to be able to be helpful to my clients. I have all this knowledge and expertise. And then, some 7 or 10 years after, I became a mom myself. And then I remember the first time I took my son to therapy, and the numbers and levels of, oh, now I understand, the vulnerability a mom experiences, the inherent paradoxes within parenting where you know things here, but your heart pulls in the different direction. I mean, so many aspects of it. I understand now why they were asking or why I was lacking. I might have been helpful in some ways, but I do believe that after having becoming a parent, my empathy, like you were saying, just the depth and width of it is tenfold at least.
And it points to another aspect of this that is like a question in training in our fields is the whether to or not to expose ourselves, just tell aspects of our own personal stories.
Yes.
And I remember when I was first trained, and my initial training was psychoanalytic. So I'm like a certified psychoanalyst. And I moved very far away from that tradition and integrated and synthesized lots of others. But you would never do that, you see. And I would talk with other people that I've supervised that have been guided not to disclose anything about themselves. And that is extraordinarily limiting in terms of our ability to be helpful.
I agree. Yeah.
Yeah, in a way that and I understand that for some people that's not a good idea. That some people have had very narcissistic parents, and they always talk about themselves. So that would make them that be a transferential kind of reaction if I was doing that. But to over time, when there's some aspect of my personal story that's very relevant for what the person is talking about, then they have a sense that when I share it, that I know more. There's a different level of knowing. For example, when I had cancer 23 years ago now, that after I had that then I was able to share that serious illness with people who had serious illness or had almost died. because I almost died from my cancer. So that when I was able to share that, you could feel palpably how they quieted down. They just quieted down and felt that, oh, now I know, now I'm with someone who's a professional, but also a human being who knows, has some clues about what it's like to be me.
Yeah. And there's a difference, right, between knowledge and wisdom. And it's wisdom that tells us, helps us um, sort of feel into what part of what we know and have gone through will we share when? Like you were giving the example of the narcissistic client who might not appreciate his happiness herself.
Oh, no.
But you, when we're working, I find from the Heart Center, one of the aspects of it is it gives us access to our intuition way more. And our intuition, in some ways, is, the gateway to wisdom. And that helps us know when to share and when not to share. So, this idea of the use of self as an instrument or in service of the client, there is that concept, but that's sort of a theoretical concept. What does that mean? When do you?
What does that mean in terms of lived experience?
Yes. And I find that the more I relax into let go of all my knowing, not that it disappears, it's still there, but I think of it sometimes as who's leading. I'm leading with thinking what is going to be the next best thing to ask or say, or what theory fits here versus, asking the mind to take a back seat and sort of sinking into myself and my intuitive self. I find that, what I say and not say sort of comes automatically and it ends up being so much more well received than if I think I knew better, as opposed to trusting the felt sense of the heart space, of my intuition, of what I think of wisdom as different than, the knowledge.
I very much agree. Yeah, that's a similar experience.
Yeah. So you mentioned one of the things is the advantages of working from a heart space is that it creates trust. And I think another important piece is that humans are not machines, that are in need of fixing. And we all feel when somebody is trying to do that to us, right? When it's sort of focused on, here's the problem, what are we going to do about that? As opposed to this more caring interchange. When there is true deep caring, I find that people can sense that, first of all, but then they really appreciate it. I'm sure you have had clients, I've had clients that thank me for being human.
Yes. Isn't that a remarkable thing to hear? Yes.
It's absurd, don't you think? What has happened in our field that our clients don't expect us to be human? And we get paid for it, when we share some aspect of ourselves or when we are not afraid to show our true deep caring. And I know you talk at length in your book about how we do that. You do it with offering tea when your clients come in. I'll let you speak to some of the ways you show. One example I have is I'll always let them know I'm thinking of my clients outside of sessions, which also at school, we're taught to be very boundaried about that and definitely not to disclose it. And yet I find that when I say, as I was thinking of you this week or this morning before our session, that is a way for me to let the person know I truly, deeply care about them.
Yeah. And So sometimes I recently had a time this particular week where because of my age, I don't remember the specifics at this point. That's what happens with old man memory. But I do remember waking up in the morning thinking, I hadn't thought of this aspect of this part of what my patient, I'll just say Bob, was talking about. So I as soon as the session started, I said, Ari, I woke up this morning and I was thinking about you, and this is what came into my mind. And that person was really profoundly struck by that I was thinking about that, showed an aspect of caring. And then people ask me, well, how do you do this people ask me, how do I do this kind of work so you don't get you're not carrying your stuff all the time that people so and there's the territory to navigate this kind of work. Is how do we do that, and how do we not let all the feelings that people carry into our space here, into the space in between us, how do we not let that overwhelm us? And so patients ask me about that, and I explain it to them because they want to know. And a part of it is they want to make sure that I'm not burdening, that they're not burdening me, that I'm not a burden to them. I have numbers of times people ask that kind of question, and my response is, I never feel that way. And they just astounded. How is that? And particularly those people who are like in some kind of caretaker way, either in their work that they do or in their own families. And they ask me, like, so how do you do that? And I tell them. And it educates them about something I do during sessions. So, like, I always think about that there are aspects of my own personality that are also present to me. So, like, I think of my higher self, which has an aspect of greater capacity for empathy than mine. I call it, sometimes I'll refer to it as big heart, as opposed to the small ordinary heart. So I think of that part of myself is present. And what I do is I think about that part. In fact, I have a little figure over here, which I'll show you, and I sometimes show my patients. That is a concrete representation of that part of my personality. So I will look at it and then breathe. Look at it and breathe. And so that what happens is that I'm drawing on that part of my personality, taking that energy of that in and releasing their own vibrational energy of sadness or of anxiety or hopelessness, so that it doesn't come inside of me and stay with me.
Yeah.
And also that keeps my heart open during the session, because if I'm being overwhelmed by the bigness of the feeling states, eventually my heart is going to shut down. Yeah. That person won't know it, but I'll start to become more distant.
Sure.
Because it's too much. Yeah. So how do I draw on something that's larger so I don't get in that state, but at the same time keep the flow of our connection? So I'll show you this piece here.
Yeah.
And it's right here. See, it's visible to me.
Oh, beautiful. Hello, beautiful. Mm-hmm.
And that's something that my wife Jean gave me 25 years ago. It's carved from a second growth redwood.
Oh, wow.
And it somehow reminded her of me. And so I've had it for a while, and then I gradually thought of it. Oh, it can be a concrete representation for me of that part of my personality, which I call wise heart.
Lovely, yeah.
And so then I'll explain that to some degrees with some people, particularly people who are in this kind of work.
Yeah.
or who are caretakers in their families, I'll explain it to them in detail like this. Other times I just say, oh, I do it through breathing. But they'll then, when I give that explanation to people, then they see me during sessions go, oh, like this. They don't think that I say, oh, I thought, I knew you do that, Bill, but I thought that meant you were bored with me or just worn down. So now that no longer projecting, they know what's happening. See.
Yeah. My version of that is practicing mindfulness. I was lucky enough to go to Europa University, which was built by a Buddhist monk, and he wove mindfulness practice into all the branches. And I find that especially for us therapists. And, some of what I hope to do is really geared towards therapy students and young therapists. And I find this is so crucial to prevent burnout. It's almost, you can't do this profession if you don't have different ways. And this is really sweet because you have your way with Wise Heart types of parts work, strengthened by an art object. So it's almost like art therapy is woven into it, which I find lovely. And for me, more typically, of course, I have many, many other self-care ways, but especially in those sessions where what we're receiving is too big for my human heart, I will make sure my witness function is present so that what is coming in, I'm able to observe it rather than just letting it come in as, in its full intensity. So for me, mindfulness practice, and of course, it involves the tracking of our body, of our breathing. Yes. It sort of serves the same purpose.
And I'm very familiar with all of that because I do have a meditational practice of my own, and et cetera, and I've incorporated mindfulness into my everyday life. So yes, it's in the same realm. Yeah.
Wouldn't you want to make it mandatory for people in our profession? I think actually learning not to meditate per se, but learning about mindfulness, which can be done through mindful walking, through, a million crocheting. Mindfulness can be applied to anything and everything. And meditation is more the classic way of practicing it. But I think, number one, doing our own therapy work, and I know you talk about that in your book as well, and learning mindfulness should be non-negotiable. I often say, if you haven't sat in the chair of the client, you have no business sitting in the seat of the therapist. I don't know if you think.
I certainly agree that it's really important for every therapist to do their own personal work, so they're aware of how that impacts the exchange with with their own clients and patients. What I would say, rather than specifically use mindfulness, what I would like to see is in every training program have a whole course on self-care, and then offer a number of different modalities that help people with self-care. And so that then what I'm talking about and what you're talking about can be brought into it. And there may be for other people a different kind of modality that will help them. And so to expose them to an expanded range of this, or try this could be done or that could be done, whatever fits for you, but at least here's the menu of possibilities, and emphasizing that in order to do this kind of work, that it's a powerful impact on your heart, on your emotional life. How do you deal with that without getting burned out? How do you deal with that so that you can be fully present to your client? How do you deal with that so you don't bring home what into your home life, or that you're so depleted that when you go home with your own children and partner, that you can't offer them what you offer your clients? I can't tell you how many times I've talked with people who are therapists of various kinds, and their partner says, "How come you treat your patients better than you could treat me?" And the reason is they come home so depleted that they have nothing left. So how do you recharge your batteries? How do you do all of these aspects of self-care? That people who come to this kind of work, oftentimes they're not good at taking care of themselves.
Ironically, yeah. Or paradoxically.
Yes.
Yeah.
Yeah. And so I think some kind of course that you make as part of the curriculum that offers an overview of that and a number of different strategies for working with that would be extremely valuable.
And it's never only for us. When we become experts at it, I cannot think of a single client of mine who hasn't benefited from my sharing what I've learned. Because to be honest, who doesn't need some level of self-care in this world? And self-care to me is sort of really synonymous with self-acceptance, right? Because you have to first feel like you deserve to relax before you can give yourself permission to do it. So I find that for us, it's absolutely non-negotiable. But as we learn to do it, it always comes back to our clients. And it comes back in an authentic way that you and I so cherish.
Yes. Mm-hmm. Yeah. Yeah.
Yeah.
And then when I talk with people about my clients about this, that I make a distinction with them between doing this self-care or taking care of self and being selfish, because a lot of people have trouble with this, particularly people who do this kind of work, because it makes them feel selfish. And that's one thing they don't want to feel.
Yes.
And when I explore people, when I have anybody as a patient who's doing any kind of healing kind of work with others, to explore this whole area and just know in depth what the issue is for them about being selfish. What does it tap into their own personal stories? And then to help them to have permission to take care of themselves. And what I usually talk about is I spell selfish with two different ways. The way that they're talking about it is like I spell it with a small s, and that means that they're being self-absorbed, self-centered, only concerned about yourself. That's true selfishness, as opposed to spelled with a capital S, when you're doing something that values comes from your higher self. And the thing that I talk with people about is actually the people who benefit most from you become that kind of selfish are the people that you care about the most, because when you take care of yourself, you have more energy to be able to be there for your clients, your patients, but also your children, your partners, your friends.
And you're role modeling what it means to be selfish with a big S, or to be selfish in a way that is good and wholesome. Because I think very often we teach through role modeling, through doing it ourselves and letting them see, when we say no to a client, let's say, for me, Saturdays are a no. I will on a work on a weekend, but I do work nights though. Saying no or not negotiating with the price after a certain amount, those things which end up hurting us when we're able to say no to them with our clients, it actually has a positive impact. Like when I can say no, the client goes, and I have experienced that in my seat as client as well. Oh, She said no to that. Good boundaries. I like that. I want to do more of that, was my response. Yeah.
Yeah. Yeah. And when I was a parent, I never worked Saturdays because that was a time to be home with with my children. But now, as I'm getting older, I don't like working nights, and so I want to be home with my partner, with my sweetheart, and so then Saturday mornings substitutes for that. Then
Makes sense.
yeah. And I totally agree with you in terms of the importance of various kinds of modeling. And this, again, is not something that really gets talked about enough, is that we're, a main goal for the work, and any of us who do in-depth work, is to help the other person be authentically who they are, to become into who they are as a person, and to be authentic to that process. And so that to be more authentic human beings. Well, if we're not modeling that, if we're just being the professional in a role that has narrow confines in terms of how to be, without being the way that we are as human beings and showing them that, then you're not modeling how to be an authentic human being.
Absolutely.
And 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 people respond to the dissonance of that.
They always know when you're not authentic.
Yes.
Yeah, we just feel it in each other.
And yet the training for many people in the fields is emphasis on professional, and by professional they mean emotionally distant.
Yeah. So let's talk about, I was so struck when I picked up your book, and the first sentence you wrote is, I love my clients. And I thought, whoa, he's so much more courageous than I am. Because as I'm working on my manuscript, I haven't yet finished my book. Somewhere in the third chapter, I approach the topic of love. And I say, one of my supervisors thanked me for loving my clients. And later I thought, like the other, the thank you for being human, the thank you for loving my clients, I felt was a little absurd. Of course, I love my clients. Could we do this work if we did not love people, first of all, let alone the clients that we get so close with? They share with us their utmost vulnerabilities. Such a gift we receive. And to not feel utterly honored and in love with them, to me, it is not possible. And yet, that word is so problematic, isn't it? So let's talk about the concept of love, what we mean in therapy when we talk about, I love my clients. What do you mean?
Well, it's what's coming back into my memory is when after doing my last book, that I did a number of interviews on radio shows, and I remember the person who had asked me to come on and do this interview, and had read my book and really liked it, and she was a psychiatrist, and she said, "I wish you hadn't put that sentence in there. I wish you hadn't used the word love. If you used the word nourish or some other word, but that word love." And so it led us into the conversation. So I said, yeah, well, see, part of the problem is what we associate love. So what people oftentimes, first thing that comes into their mind is sex. Intimate, that kind of, it's an intimate relationship. So they think, well, if you love the person, now you brought the element of sex into it. And that's our cultural madness.
Yes.
That's Western culture madness. That's about. And so I've intentionally tried to counteract that. Yeah. So what it is I mean, also my first book that I wrote was called Love Blocks. And it was
It's a lovely concept to please explain.
Yeah, and what I meant by that is that people have a difficulty in receiving love. And so there's a lot of psychological blocks, oftentimes unconscious, to the to being able to be receptive to the love that's in our lives. And all of us had that. All of us.
Yeah.
And I'm still working on some of those for myself. And I did a lot of interviews that time because it was a book by a major publisher, and so I did interviews on TV and radio, etc. And I quit. That's it. And people would ask me, so how would you define love, Dr. Ryan? And I said, I don't ever define that. Philosophers and poets have been trying to define love for centuries, and nobody comes up with a real thing. I can tell you what I focus on is the feeling of being loved. Okay, which is a whole different territory rather than try to define the undefinable, because it's like trying to define God or forgiveness. How do you come up with a definition of the undefinable? So I'm more think of it in terms of the work that we do, that by love in this perspective, I mean that each person who walks in the door and into the office here, they have an essential part of their nature, the essence of their being. Okay, I will refer to that as soul. Some other people a different word, but what I mean by that is the essence of their being, and everybody has a certain essential way of being. And that way of being shows up throughout their whole lives. It can be wounded, it can be evolved, is affected by life experience, but there's an essential way of being. And all of us who are parents, or now I'm grandparents, right away from very young to the first 5 or 6 months of life, this is how my kid has been. I didn't do anything to encourage that or discourage it. They've been that way from the beginning. And now is 18 or 25 or 37, still that way, it shows up.
Yeah.
So that's their essence.
Yes.
So one of the jobs, a primary job that I think of as a therapist of any kind, is help people to learn how to value that way.
Yes.
See, to value and really appreciate and love themselves for that essential way of being.
Yes.
And then another aspect of my task is help them to to remove or confront or the obstacles to that. What blocks them from feeling that way about themselves? What life experiences have happened? That, what cultural experiences, what personal life experiences have helped them not to feel that way. So we're going to look at that and begin to, with compassion, look at that and to lessen the impact of that and develop a better, higher sense of loving yourself, caring for yourself, valuing yourself as a person and who you are. So that is, so my doing that with compassion, and also, and never blaming any of the people who may have wounded them. I always say that to people. I'm never blaming your parents or your uncle or brother or whoever. There's no blame. They're on their own journey. And also helping people not to devalue some of the mistakes that they made. The way I bring it is you are in an earlier stage of your evolution. So we're now looking backward with compassion on you at an earlier stage of evolution, that you made choices then that you would not make now, but you were at an earlier stage.
That's the upside of aging, isn't there? So many downsides, but the one upside is we do move towards, if we do our inner work, becoming better and better version of ourselves, or exactly what you mean, coming closer and closer to the essence of who we really are, or in other words, becoming more authentic, simply said. Yeah. Yeah.
Nice.
So we're not talking about sexual love. We're not talking about sentimentalism.
No.
And I know your last chapter and one of my current obsessive concept that I'm obsessed about and share with everybody and will be included in mine as well is John O'Donoghue's. I don't know the exact pronunciation. Anam Cara. So if you want to speak to that a little bit.
Sure. I think, and that's why I wrote that as the last chapter in this book, that to try to help people expand their notion of what a therapist does. And so the phrase Anam Cara, Anam, my background is Irish. Both sets of my grandparents were Irish immigrants. So I understand a lot of the struggles nowadays with immigrants. And that, so in the Irish tradition, in the Celtic tradition, the word anam means soul. And cara means friend. So a therapist then can become a soul friend to the client. And so that then the answer to my, if I didn't think of that when I was being interviewed by the psychiatrist, but if I had been able to bring that up, I mean that. See, that's a kind of love that if I'm offering myself to be a friend to your soul.
Yes.
So what does that mean? Well, it means a couple of things. It means I value the essence of your being, and I'm here to help you do that more and get rid of some of the obstacles you're feeling good about that. I'm also here to encourage you and challenge you to become more true to your authentic self. So that it's not going beyond valuing, but also to help you more and more, a step at a time, to become more and more truly who you can be. Then I'm a friend to your soul.
Yeah. So never missing an opportunity when we see that soul essence emerge in the session to delight at its appearance on the one hand, and also I never try to miss an opportunity to catch when the inner critic or any other barrier might come up trying to smash it down. I have always go, oh, there's the critic. Hello. Not true. So not true. So both delighting when we meet the essence. And I think this is part of our authenticity. And I hope that some of this conversation creates permission for especially younger therapists to do things like this, that we get to smile in delight when that happens. Or sometimes I'll actually go, woohoo, in a session, which I would never have done such a thing when I had just come out of school, with all the rights and wrongs of things to do. So celebrating with our entire body and delight, and then also, catching and trying to remove the barriers that get in its way.
Mm-hmm. Yeah. Yes. And those opportunities when they come by, and especially when they feel in some way bigger, it's important to acknowledge them. So I always take time out to do that. So I'll say, you just said something and moved on. You just said something that I feel, the patient will say, I feel good about what I was able to do. And then he'd go on. I said, I'm going to stop.
Yes.
We're going to stop. We're going to take time out to honor that moment of your growth. And then I take it a step further. In that I say, now what I want to do is, on one side you have all these issues about self-esteem and sense of woundedness and sometimes self-hatred or self-loathing. So that's on one hand. What we're trying to do is lower that and I use my hands because that's part of my authentic nature, is very expressive with my hands. So I hold my hand out and I'll say, so we're shedding the light of compassion on that and looking at the whether, because you have that as a truth, that I'm the piece of shit or whatever it is. So as if Moses came down with an extra tablet, the 13th one says you. That we're looking at the truth of that with light. And on the other side, that whenever there's this moment when somebody says something really good about you, or that you feel good about it, to revisit that moment. And then I said, use breath to take it in more deeply. So you think of the moment that I felt good about what I just did, or somebody said, boy, you did a great job. And then you take that in and you breathe. And imagine at the exhale breath that the negative feelings are being diminished. You're letting go of them. So this is coming down and this is going up. And the moments that we do that as therapists help them to pay attention to that process more.
Yeah. I have a chapter I started on slowing down years ago, both in the way you say, right, really slowing down so we honor or we celebrate that which is just, a big deal, a moment of self-compassion and self-love. But also, as problems are talked about, it can be, so much can be there. And I found that the less is always more in therapy, number one. Number two, an older psychologist years ago, I had asked him if there was one thing you would want to, pass on to me, a word of wisdom, as if there can be one. But he had said the psyche moves in glacial speeds. And I really pondered that, because glacial speed is awfully slow. And think about our capitalist Western society, or our insurance models that have us do short-term therapy, and, speed and efficiency is so glorified. And yet what the soul needs is the exact opposite, isn't it? So
Glacial is an exaggeration. See, he's using a metaphor. I understand. And all metaphors in some way are exaggeration. I get that. But, yeah, but he's guiding you, and he was guiding you, and you internalize it. And I feel the same way, that the growth are steps at a time. Just a step at a time.
that comes up so often with grief, doesn't it? Whatever the grief is for, an actual deceased loved one or a loss of a capacity, it just takes time. We cannot rush it. We cannot rush the soul. And yet, I see everybody trying.
So if we're able to offer a voice of caution in that, and make a distinction, which you make in your book, I remember, between chronos and kairos, the different elements of Greek time. The Greek words emphasize different elements. So the chronos time is the time measured by our clocks. And kairos is another dimension of time where our soul is living in that time. And that time is, sometimes you experience, like, if something is, you're having a great time with something, it seems so short. But this painful moment where I'm waiting and I'm bored and it takes forever. Those are two different experiences of time that have come from another place. The clock ticking is a different time. And in our time that we talk about, the work we do with people, that's in Kairos time. It's a slow time. And I find this is like, all the different kind of modalities can be helpful in certain concepts. So one of the great concepts from the recovery movement is a step at a time.
Yeah. Yeah.
a step at a time. So the growth is a step at a time. You're taking things on a step at a time. And that's how real growth happens. If it happens fast, what's going to happen is a bigger fallback.
Yes. Yes. As it happens with healing physical wounds, when people go back right to the sport or to stage too quickly, it makes the injury worse.
Mm-hmm.
Yeah. I do want to add, so slowing down, the speed of time is one element of Kairos time. But also, this was something I tried to engage in conversation with my husband, and I always lose him. So he was telling me, you're going to enjoy your conversation with Dr. Ryan because he's going to get what you're trying to say. And the pieces, and I know you wrote about this as well, it's not only the relativity of time, how we experience it differently, even though it's the same unit of time. I think the psyche can time travel to the past and to the future, and this is utterly non-scientific. So in some ways, I say the psyche, when we're dealing in psychology, there's a part of it that adheres to the laws of science. A lot of it can be studied. And then there are these mysterious elements or parts of it that can be approached only through mythology and story and art, because we can literally go back in time and have conversations, engage with our younger self in a way that changes reality. Probably not for the young one back then, but for the young one that continues to be alive within us, as well as our older selves. And also, I've had experiences with clients of traveling to the future.
Mm-hmm.
So, this to me is one of the miraculous aspects of what we get to do. And I don't mean miraculous in the sense that it's not real. In fact, it just can't maybe be explained. It's more, it remains mysterious to us. And yet at the same time, it is as real as any other experience.
Yeah, I the way I think about that and talk about it with my patients too is one of the challenges and one of the great things about a human being is that we exist at multiple levels of consciousness at the same time. And some of us are not aware of that. We think we only live in one realm, which is the real world, the practical world, the rational, whatever that means for that person. And yet there are aspects of our being that are in other levels and other realms of consciousness. And so that how we are able to more access that, first of all, is need to be aware that they actually even exist. So lots of times we have to be able to educate our patients about the existence of the unconscious. What? Yes, the unconscious and the layers of all of that. And so yeah, in these other realms of consciousness, you go back in time. And so one of the things that's happening is a number of times for people that are experiencing the now from when they were 7 years old. That part of themselves is really what's interpreting the event as the same as what happened then.
Yes.
And that's a more common experience, at least that people. And so we can also, you're speaking to that means that that part of us still exists and walks with us all the time.
Yeah.
So I know my younger part of myself that I sometimes simply call Billy Boy is having some experiences with me, and as it is part of what's happening. But also that in the therapy you can have your adult self or older self or elder whatever have conversations with that part. And I was actually having a conversation with one of my patients this morning about that. He was wounded. He was just revisiting some wounds of his father, and he's of late. He's been talking about, like, I'm so enraged all the time at what I think about him. And I say, well, yeah, as an adult man, but it's really young Bob, who's now experiencing the feelings that he contained all these years, and they're now flowing out of you. So you're giving him permission to have the feelings. And then, and also what you said, there are a lot of people, I agree with, a lot of people don't really think about this too much, is that we also can not, and different people with varying degrees can experience something that's not yet happened, that they're having a connection from some realm of consciousness to some future event. And for somebody who's a very rational, scientific person, say, how is that possible? Well, they haven't heard the stories that we've heard about how somebody knew at the moment of death, or 3 months before somebody died who was a beloved, that person is dying, or that person just died at this moment. How do they know that? Where did they receive that, quote, information? Because when you have a heart connection, you're connected in heart and soul to somebody. Now you experience things from those realms of consciousness, even if that person is quite a distance away, or you have a sense that something is going to happen to them. If you've heard, so people say, well, where's the scientific evidence? You can't replicate that in a laboratory. But another form of evidence is, if you've heard hundreds of stories of that, then something is going on. Yeah. And if in native peoples all over the world have many experiences of these kind of things, you'd say that is evidence also.
And it also becomes so precious when people are struggling with loss. It is through our heart center that we can relate to somebody who's no longer there in body. And so much healing can happen through that space. And again, that's one of those mysterious elements, right? The person is in the ground, long dead, and yet through our heart center, we can connect. Not all the time, not every minute, but there are those with effort moments where we can have a true, real connection, where there's an exchange and where, relief and healing can happen.
It's interesting you say that, because I had the experience with one of my patients just yesterday, who his mother was very emotionally distant most of his life. And somehow with the aging process, that all of a sudden she opened up her heart and was a very different kind of mother to him in the last 5 years of her life. And she just died a year ago. And so he's talking about grieving that, which of course he's still grieving, unlike, because the grieving process takes quite a long period of time for those particular kinds of losses. And he was feeling so the loss of her, but more the loss of opportunity, that now she's died and I was just getting the mother I've always wanted, and now she's dead. And how that was another layer of sadness. Yes. And I was able to tell him from personal experiences, both of my parents died over 30 years ago. Probably almost 40 at this point. I said, well, the thing for you to know that I can give you from my experience is that your relationship with your mother is still evolving. And he looked at me like, what? Yeah, it's still evolving. That I've had the experience, and many people have had the experience, that because there is a heart and soul connection to that person, that person's energy is in some mysterious way that nobody can really explain, that there's still that connection continues. And whether you believe, and for some people who have trouble with that kind of explanation, I say, well, that person still lives inside of you. The memory of her still lives inside of you.
Yeah,
So
you always call it memory space.
right, exactly. So you're having a dialogue with that memory. Okay. Or if you think, as like I believe, that that person in some form or some non-form still exists, then you're having a dialogue with that person. Even though that person may not come back, it most likely is not going to talk back to you, at least that you know of, although it may show up in a dream or some other way, that something is happening. And your relationship, so I know my relationship with both my parents has evolved significantly since their death.
Fascinating, isn't it?
Yes. Yeah.
Mhm.
So that can be helpful with grieving,
Indeed, yeah.
especially grieving big losses. Yeah. Yeah.
Hmm.
And if you hear enough stories from our patients, as you've had and I've had, enough personal experiences, then it's, quote, evidence
Yeah. Yeah.
that we can't do a double-blind study on and demonstrate scientifically that it's, yeah.
But no less real because it's part of our lived, felt experience. Yeah. I often think of us as way more fluid, which makes that study, methodological study, quite a bit difficult because there is so much flux and change, which for me is another reason why working from the heart center and with intuition is so effective, because I can never know, regardless of how much I know from the theories or how much I've studied, the case file of my client or patient. I can never know. I call this the unknowables, one of them. What might be most helpful to you in a given moment. And if I cannot know that, that creates a conundrum, right? But if I can relax into not needing to know and trust at the process and us sitting together with that unknown, that it will reveal itself, it always does. But if we try to grasp it and know it ahead of time, we don't. Then we're commandeering a session and making it go somewhere which is maybe helpful, but never as satisfying as those sessions where I let go of all the knowing and just relapse into, what are you coming in with today? And sometimes the client themselves don't know, and we have to take some time, to get their mind to quiet down, for them to connect. And then it sure reveals itself.
Yeah. I can't tell you how many times people come in and say that, Bill, I don't know what to talk about today. I said, oh, okay. And let's just sit and be with each other and just see what comes into your mind. And sometimes that's the most crucial sessions.
Yeah.
And then other times, and relating to what you're saying, is that, and again, the more you do this work, the more you try to connect to other realms of consciousness in doing this work, that then the more that things happen that are part of a process that you're not in charge of, that it's in other hands.
Yeah.
And so the numbers of times where I've thought afterwards, oh, that was a dumb thing I said. And the next session a person comes back, boy, that was so helpful what you said to me last time. Or they'll say, gee, it was great helpful when you said this, this, and that. And my recollection is that's not what I said.
That happens too, yeah.
Yeah, but somehow they heard it in a way that was helpful to them.
Yeah.
And so something else is going on that's in some other realm that's not totally rational, it's not planned, that it's unfolding.
Yeah.
And the more you do this work, the more that you then begin to have trust in that. I was talking with a patient today, and I was talking about this fellow. I would like to tell you aspect of his personal story, but I don't want to because that would affect confidentiality issues. But I was talking about the importance of trust, and he said, just the way you said it, I've always thought of trust as like a passive thing. You're suggesting that it's an active process.
Yeah.
And I said, yes, right. And that makes a difference.
It does.
Yeah, it's something within your power.
Yeah, just possibly, especially for young therapists who are often so fearful about doing the wrong thing, seeing the wrong thing. First of all, everything is fodder for therapy. It's quite all right if you're not attached to completely mess up, as long as you have the humility to take a look at that and see what the effect has been. But aside from that, it's also, we're not really alone. There are forces helping us. I believe that when we let go of the worry of knowing we're making a mistake or having to say the right thing, we are gifted with saying things which can be the just right thing to say. And you could have not thought that up. It's like a gifted inspiration that can come through.
Yeah. So, and yes, exactly. And I would add one thing to that, which is that, like I was talking about before, being connected to our own higher selves so that we can access those, but also to know that the higher self of the other person is also present.
Yes. Yes.
That person's higher self is also present to be there for them, to help them receive what we have to say in a way that be helpful to them.
And I know both you and I read it in your book, and we pray to the higher self of the other person so that they can help create a landing space for what is needed to be received, right? Because sometimes we know exactly what they need, and we might even say it. But if there's no landing space for it, it goes on here, goes out the other side. It's not helpful. And sometimes when I pray, and I'm curious about your experience, something shifts. Something that I didn't create shifts or can shift.
Yeah. I'll share with you a bit that what that relates to for me. Yeah.
Mm.
So, and this is very personal. So, when I come into this space here, and it's a sacred space, and so we think, Jean and I both think that we create a sanctuary for people,
Yeah.
a sanctuary, so that then before I start seeing my first patient, I take 5 or 10 minutes every time, and usually a few minutes in between sessions, and I pray. And my prayers are multiple. So I look at that depiction of my higher self there that I use, my friend Weishart, and I say, help me to be a compassionate, patient, open-hearted presence. And then I look up that way. And at this stage of my life, I was raised in a particular way in the Catholicism that had a particular worldview of God. And so much I internalized that I even studied to be a priest for a couple of years. But I moved away from that. So I have a different image. So I now, since God is unnameable and whatever that means is undescribable, I simply say the old one. That so something has been around for millennia, eternity. And so I look upward, as people through all history have done. Even the native people say the Great Spirit. They always look upward.
Yeah.
And so then I say, and as I look up, I say, help me to be a vehicle of divine love. Help me to be a vehicle. And after each one of these things, I do some breath. And I look over there, and I this photo up there of not a photo, is a painting of us of a pond. And I say, help me to be a vehicle of peace in stillness like that, or in the flow of life. And then I look over there, and you'll see over there, there is small statues of, in the back, there's Jesus and Buddha. And then there's the Carl Jung's book, and there's all these books here, etc. So I say, help me to be open and receptive to guidance from many sources. And then I look over there in a blank wall, and I say, help me to be open and receptive to other realms of consciousness. And I breathe out each of those. So now I'm creating that intentionality, and also I'm trying to create an interior space of receptivity. And that's why I say, I come get my first person of the day and say, welcome, go on inside. It's good to see you again. And we start. And then I'll do that in between patients too, because I'm still in the energy realm of what transpired in between in the first session. Then I do a little bit of that too. Or sometimes in the middle of the session, I'll just look and breathe, because I know what I'm trying to breathe in during that time. Yeah.
Thank you so much for sharing that. And I think it's a perfect way. We'll continue our conversation, but we can stop the recording. Thank you for sharing that, which was very personal. And I think probably among the most precious that we have discussed all afternoon. Thank you, thank you, thank you.